Hello and welcome to Pro Live, everyone. My name is Cori and I am your co-host for today's very special show. You are in for such a treat. We have some amazing co-hosts with us today and we are talking all about Skincare 101. We have moderators in the chat ready to answer any of your questions, 2 exclusive sets, which we're going to get into in just a second, as well as amazing offerings for you to take home and take advantage of for the next 45 minutes. But let's go ahead and introduce our amazing co-hosts. We have Sarah Kinonen here. She is an Allure beauty editor. And we have Dr. Geria. Say hello, guys.
Hi.
Hello. So excited that I am joined by these 2 beauty experts. And they have so much information and education to share, as do I. And I just want you guys to take a moment and introduce yourself to the audience. Sarah, we'll start with you. How can our audience connect with you? How can they follow you along on your journey?
So you can find all of my work at allure.com, but on social, you can find me at Sarah Kinonen, Instagram, TikTok, wherever. That's where I'm at. That's where I am.
Amazing. And we're actually going to plug that in the chat so everybody can follow along. And how about you, Dr. Geria?
Yeah, so my Instagram is at drgeria, Geria. The Instagram handle for my practice is at Geria Dermatology, and the website address is GeriaDermatology.com.
Love it. So make sure you give them a follow. Today we have 2 exclusive sets, as I mentioned earlier. We have a morning glow set and an evening radiance set. I'm going to walk through these really quickly before we get into our discussion. So up on the screen, you're going to see the morning glow set. The morning glow set features amazing products to get you started on your skincare journey or to really take your skincare journey to the next level, because it contains all of the essentials that we're going to talk about in just a little bit. Everything that you need to maintain healthy, radiant skin. It comes with a CE ferulic, our gold standard vitamin C antioxidant. You also have HA intensifier for plumping and firming, lifting hydration. You get a sunscreen to protect your skin and the investment that you're making in your skin. Not only that, but we have your lips covered as well. We have antioxidant lip repair to really help smooth fine lines and replenish lip tissue. And then for a treatment, you have phytocorrective essence mask, all in that morning glow set. For our evening radiance set, just to give you a little taste of what's in here really quickly, we have a retinol. You actually get to choose your retinol, which is really great, right? Because not everybody is ready to start off with like the most powerful retinol. And at SkinCeuticals, we have 3 different strengths. So choose your retinol. We're going to discuss which one you should choose based on where you're at in your skincare journey in just a little bit. In addition, you also have Triple Lipid Restore 242 and then our Resveratrol BE in that evening radiance set. In addition to that, if you purchase both sets, you're going to take home our phytocorrective essence mist. And we were actually just chit-chatting about this earlier. This is such a skin boosting, soothing, hydrating mist. Helps to reduce visible redness and hydrate the skin with humectants. Or we might have to just mist this on ourselves.
Yeah, let's do it.
Just a little bit, right? Because I'm already feeling a little parched.
Yeah.
I think I need a drink of hydration with that. You're also going to be receiving a gift bag, a cosmetic bag. I mean, who doesn't need another bag? I can fit all of my products in here. It's so beautiful. You're going to be receiving this with your purchase today. And then 2 additional gifts with your purchase. You get to take home little minis, which I love just for travel and just anytime that you don't want to carry like big products with you. Really beneficial. So you have Triple Lipid Restore and HA Intensifier in deluxe mini sample sizes included in your purchase today. And as always, you're going to be receiving a voucher, a $100 gift card with your purchase, redeemable at a SkinCeuticals Skin Lab or flagship location near you. After the show, you can actually locate one nearest you by going to SkinCeuticals.com and using our physician locator, and you'll see offices pop up near you, and you can actually take advantage of in-office treatments, procedures, consultations, and shop the entire SkinCeuticals product line. Dr. Geria, one of your offices is actually a flagship location, right?
Yeah.
Can you tell us a little bit about your office, your practice, and what you do there?
Yeah, so we have 2 locations in New Jersey, one in Rutherford, and Rutherford is the town next to where Giant Stadium is, or MetLife Stadium now. We opened that one in 2018, and then about a year ago, we opened up another one in Verona, which is close to Montclair, and that is the SkinCeuticals flagship. And we do a combination of medical, surgical, and cosmetic dermatology.
That's fabulous. I am actually going to probably book an appointment and go see you because we actually spent all Saturday together. I think we have some behind the scenes action that we can pull up on the screen for our viewers to look at while we chit chat through this. But Saturday was a very special day, especially for you, Sarah, and your team at Allure, and for us at SkinCeuticals and Dr. Geria as our, one of our key opinion leaders and physician partners. We had a blast. I couldn't believe it. It was so much fun for everybody that attended, for us that were working it. Can you tell us a little bit, Sarah, about the first ever Allure Best of Beauty live event?
Yeah, so it was our very first live event for all of our readers, but we also hosted experts, friends of Allure, all of our editors, and all of the skincare fanatics and beauty lovers throughout the tri-state area. This was such a fun experience. I think we had like 1,000, maybe a little more, people come through, and there were a bunch of different brand booths. But SkinCeuticals was actually right in front, and you guys were offering live consultations and recommendations. I got a little recommendation at the beginning for a very special serum that we'll probably talk about later, but it was wonderful.
It was a blast. Dr. Geria, can you speak a little bit about your experience? I know that you were right there with me providing expert skin consultations and answering questions from consumers that were able to come up and chat with you.
Yeah, it was a lot of fun. So people came, they said, we asked them what are their skin concerns, figure out what their skin type is, and then we had these treatment cards where we can kind of basically build them a routine. And the nice thing is we had the products right there that we could put the products on their hands, and then they could feel the texture, see if they liked it, see if it blended in with their skin properly. And yeah, it was just a great experience.
It truly was. And again, I had so much fun with both of you there, and I was just so in awe of all of the beauty lovers and skincare lovers. And at SkinCeuticals, we were just so proud to be partners for the first ever event. We will definitely come back next year.
And we will definitely have more.
Awesome.
Yes.
Is that something that you guys are going to continue doing at Allure?
Yeah, so our Best of Beauty process is 12 months year round. So this was the very first time that we had a live event, and after the great success we had from our brand partners, our readers, our editors, we've already decided after hour one that we're going to be back and bigger than ever next year.
And how, for everybody watching, if you didn't get to attend and you just didn't know that this was going on, and if you're a big fan of Allure magazine and just a beauty lover, a skincare lover, SkinCeuticals lover in general, that's a tongue twister. Can you tell the audience how can they keep in touch or stay up to date or know when that's coming up again so they can buy a ticket?
Yeah, of course. So every year our Best of Beauty Awards launch in September, and moving forward, our live events will be in October, but you can keep an eye out on our Allure social handles on Instagram and Twitter and Facebook. And then you can also catch any information, extra details about all of the events at allure.com.
Fabulous. So speaking of that event and all of the fun that we had, a lot of the questions that I was receiving and that you were receiving, Dr. Geria, is how do I build a skincare routine? And when it comes to building a skincare routine, there's so much confusion, I feel like. People don't know where to start. There's so many products out there. It's a lot of noise, right? So today, we really want to talk about the basics of building a skincare routine. So what in your mind is a non-negotiable when somebody comes to see you in your office and they're looking to get started on an anti-aging journey or just maintaining healthy, radiant skin? What is one product? I know there's probably more, but if you could pick one, a non-negotiable that you want every patient to be on.
So I think for sure it has to be sunscreen. Just coming from the dermatology world, just aside from the anti-aging aspect of it, we see skin cancer. Skin cancer, whether it's basal cell, squamous cell, carcinoma, or melanoma, it's on the rise. And so sunscreen is going to be your first line of protection against that. Okay, then we take in the anti-aging aspect of it, where we worry about brown spots, fine lines and wrinkles, thinning of the skin, and redness as well too. Sunscreen will also help with that as well too and help prevent it. And I can tell you the one regret that my patients universally say about skincare is I wish my parents put sunscreen on me. in the 60s and the 70s and 80s, and it's just that there's no question that's the biggest regret.
I feel like we hear that all the time as well, where it's like, I was baking in the sun in my 20s and my 30s, and now I'm seeing all of the damage. That's a great tip. How about you, Sarah? From readers, is there anything is there one non-negotiable that you think everybody should be on, or that you often recommend?
Yeah, so just bouncing off of that, I'm from Florida, and I did not wear enough sunscreen when I was younger. So that's number one. But number two is less is more. When you are coming up with a skincare routine, it should be simple and basic, and it should be less than 5 products. For me, it's a cleanser, it's an antioxidant serum, it's a moisturizer, and it's the sunscreen. And at night, maybe I'll switch it out with a retinol, but 4 products max.
That is excellent advice. Less is more. And I feel like with SkinCeuticals specifically, and when you're looking to build a SkinCeuticals routine, we make it really easy because we have 3 main philosophies, and that they are prevent, correct, and protect. So first of all, our products are going to help prevent damage. Also, we have serums and corrective creams that are going to correct visible concerns, whatever those may be, because they're different for everyone, right? And then protect, which is your sunscreen step, which you both talked about being so important. And it really is super important, because if you're not protecting your skin, everything else that you're doing is kind of like, it's you're protecting your investment in the time and the money and the effort that you're making every day with putting on skincare. So you have to protect the skin. And UVA rays, UVB rays, both of those are so damaging, as you were saying, Dr. Geria. They're aging, they're dangerous for the skin, and so you really want to make sure that you are applying your sunscreen. So speaking of that philosophy, prevent, correct, and protect, everything that we have here on our table falls into like one of those categories, which is really, really awesome. We've kind of taken the guesswork out of it for everybody that's watching at the moment. And I want to start with antioxidants. I think you mentioned antioxidants as one of the essentials in a less is more routine.
Yes, absolutely.
And at SkinCeuticals, we are the antioxidant authority. We were talking a lot about this on Saturday. CE Ferulic is our bestseller, #1 most awarded. Sarah, I think you have some info with how much it's been awarded.
So at Allure, we've awarded SkinCeuticals as a whole 27 awards over the last 27 years. And this little guy has won 7 awards. It's just so good. We've loved it, 7 years in a row.
Out of those 27, this is a 7-time winner. CE Ferulic is a daytime vitamin C serum for fine lines and wrinkles. Dr. Geria, we were talking about this earlier, that this is one of your favorite vitamin C formulas to recommend for anybody looking to start an anti-aging routine, correct?
Yeah, absolutely. I think antioxidants, I like to consider vitamin C serums to be kind of like the backup to the sunscreen. Okay, so it's going to help fight off the free radicals created from not only UV radiation, but also pollution. And, pollution is so, so important, especially if you live in a major city, if you live by Canadian wildfires, for example, it's just so, so important. So it can help with dyschromia, which just basically means brown spots. But I think a lot of things that, one thing that vitamin C serums don't get enough acknowledgement for is how it can help with fine lines and wrinkles. So it is really, retinol obviously can help with that, but vitamin C has this ability to help with fine lines and wrinkles and help with firmness as well, too.
Exactly. And I love that you mentioned the pollution, because I forgot to say we're live from New York. Hi. Hello. Live from New York City. So there is a lot of pollution just in the air, particulate matter now, ozone, diesel engine exhaust, things like that we're bombarded with all the time that cause that free radical damage in the skin. And free radicals are the skin's #1 enemy. They age our skin, they dull our skin, they damage our skin on a cellular level. They cause those harmful chemical reactions that lead to accelerated aging. And when we're looking to build a skincare routine, prevention really is like where you want to start, right? It's so much easier to start preventing that damage while also providing visible anti-aging benefits. So that's why CE Ferulic is so amazing. Not only that, but SkinCeuticals was founded on antioxidant research and science. So I had this conversation a lot on Saturday with consumers. Many didn't know that our founding scientist, Dr. Sheldon Pinnell, actually discovered how to formulate the first ever topical vitamin C serum. So that was just kind of like a wow factor for everybody. We are a medical skincare brand, and we are dispensed through like offices like you, Dr. Geria, but people that read Allure, your readers can also purchase us on SkinCeuticals.com, and they can purchase right now during the show. So there are different options for everybody to kind of purchase the brand and get to know the brand, whether you're going into an office and receiving a treatment to complement your at-home skincare routine, or you're reading your favorite magazine and learning, what's new, which is really great. So not only are our antioxidants backed by over 30 years of academic research, we also have clinical studies worldwide and over 20 U.S. patents and patents pending with our formulas. And we have a vitamin C serum for every skin type and every skin concern. CE Ferulic specifically helps to increase firmness and radiance, as we were chit-chatting about a little bit ago, but also, again, helping to provide that superior antioxidant protection, that first step of prevention to maintain healthy and radiant skin. If you have skin, you need an antioxidant. It doesn't matter how old you are, the earlier the better. If you have skin, you need an antioxidant. CE Ferulic is a great place to start.
And to add to that, if you are using an antioxidant, use your sunscreen, because one will cancel out the other if you don't cover it up and protect your skin.
Yeah, and I mean, we're all sunscreen lovers on this stage. We spoke about sunscreen just a little bit ago and how important it is to protect the skin and protect the investment. And when you really explain it in that way, it's easier for everyone to understand, oh, okay, I'm preventing and I'm also protecting, right? So you need those two things. It's almost like double defense, right? It's like you get that double defense from internal and then those external aggressors as well. But sheer physical UV defense is one of my personal favorite mineral sunscreens that we have here at SkinCeuticals. It's included in the morning glow set. We were chatting about sunscreen earlier and how much we use. Right?
Yeah.
Sarah, how much sunscreen do you recommend using?
So one of our favorite tips and tricks we've learned from derms over the years is you need 2 fingers to apply sunscreen. That means that you are putting sunscreen down the full length of each finger, and then you are putting it on your face, your neck, ears, hands, toes. Everybody needs sunscreen everywhere, but 2 fingers is really where we recommend.
I love that you said toes, because literally if your skin is exposed, if the toes are exposed, put them on the toes, right? You want to put it everywhere. Don't forget the neck. A lot of times we neglect the neck, and then I'm sure you see it all the time with patients. They're coming in focused on the face for so long, and then by the time they start to see aging on the neck, it's kind of like, oh.
Yeah, neck certainly, but also the chest, top of the hands, and top of the ears.
I never put it on my ears.
Yes.
If I take away one thing from today, I think I'm going to put sunscreen on my ears now.
Especially men, if they don't have the hair to cover up the ears, and the top of the head as well, too. Especially if you're thinning up top. Very, very important.
Great tip. Sheer physical UV defense, SPF 50. It's a broad spectrum, so that means you get protection from both UVA and UVB rays. It's also sheer. It has a transparent finish, almost like it's more on that mattifying side, so you're not going to get like an overly greasy look. And it is, like I said, that transparent finish, which works for everyone. It's really lightweight. I love that it doesn't feel like sunscreen. It doesn't look like sunscreen. That's important to me. I'm very particular about sunscreens. And sunscreens is kind of like a personal decision, right? The best one's going to be the one that you use, but you're going to love this one. I do have a little trick with this, though. It is a mineral, so you just want to shake it up really well, and then go ahead and put it on the fingers like Sarah and Dr. Geria were just talking about, and then you can press it into the skin. But absolutely love us some sunscreen. Now, when we're looking into building a skincare routine and anti-aging, we have to talk about correction. And correction is going to be different for everyone. Like whatever it is that you are trying to correct at the moment, fine lines and wrinkles, maybe it's some blemishes, large pores, whatever it may be. There are a couple of things that you can do that kind of like tackle or incorporate that tackle all of those concerns. And one of my favorites to recommend is retinol. We were chatting about retinol earlier. Is retinol something that, Dr. Geria, you recommend to patients starting when they're looking to build a routine specifically with anti-aging?
Absolutely. There's no other ingredient in existence that has more research to back up the anti-aging claims. So retinol is quite important, but it can be irritating to the skin. So it's nice that SkinCeuticals has 3 different strengths, so you can tailor it to the patient, to your skin sensitivity.
100%. And with you, Sarah, with so many actives and so many products and so many like new things that are just always coming out that you're reviewing and sharing with readers, is retinol something that just like holds true? Has it held the test of time?
Absolutely. I think our readers are, really excited about vitamin C, and retinol is its top contender. Yeah. Time and time again, they just keep coming back.
And do you use retinol?
I do.
Okay.
Yeah.
Your skin's like glowing and amazing, and so is yours. I mean, both of you have just amazing, amazing skin. Dr. Geria, do you use retinol?
Of course, absolutely. Yeah.
Take it from the experts. So do I. I love retinol so much. I know that we were talking about prescription retinols earlier and kind of like the difference between prescription and something like this that you can get directly from us at SkinCeuticals. I want to chit chat about that just a little bit. So a prescription retinol would be much stronger, right? Is it just like very, very potent? But a lot of people can't tolerate that immediately. Would you say so?
Yeah, correct. And even when we do a prescription retinoid, it is in a very gradual fashion. So it's just start doing it, pea-sized amount to your entire face. You typically will start doing it like twice a week and then gradually build it up to 3 times a week, 4 times a week, and with the goal of getting it at least 5 times a week. But the truth of the matter is a lot of people can't get to that. And so what ends up happening is they use it and their skin gets irritated and then they just stop. So a very common complaint, especially among people who have acne, is my previous derm gave me this cream, it burnt my skin, I threw it in the garbage, and here I am, 2 years later. They swore off dermatologists for a couple of years, but the acne never got better. And so, so this education is super important. But in those kinds of people, you can always start off with a medical grade retinol like SkinCeuticals, which will be more suited for sensitive skin.
Yeah, and at SkinCeuticals, like you mentioned, we have 3 different strengths of retinol. So if you're new to retinol, specifically if you're new to SkinCeuticals retinol, say you've tried a retinol before from another brand, but you're new to our retinol, we always recommend starting with retinol 0.3, which is the entry level, 0.3% lowest dose. And then after that, you can graduate to 0.5% and then 1%. Just like you were saying, Dr. Geria, going low and going slow and introducing it, very gradually into your routine is going to be the best way for you to have a comfortable process and avoid some of those retinol scaries that we tend to see when we are not using it as directed, or we're trying to go too fast or get too excited with it. It's one of those products that really requires a lot of patience, but it's worth it. Right? Like, just hold on. It is worth it. Now, if you are experiencing some sensitivity with retinol, or you have in the past, I always like to mention that our retinols also have a soothing complex in them to help minimize potential irritation, as well as we have other tips and recommendations like pairing it with Triple Lipid Restore 242, which we love to do actually in clinicals. When you pair Triple Lipid Restore 242 with a retinoid in general, so maybe it's a prescription retinol. I know that you're using tretinoin, right?
Yep.
Prescription retinol like that. It's clinically shown to help shorten the adjustment period of the skin to retinol by up to a week. So that's huge. And I know that you and I, Sarah, and Dr. Geria, we were talking about the retinol experience and the retinol journey. And Sarah, can you tell us a little bit about your experience with prescription tretinoin? I know you were saying that sometimes you do a buffer type of action?
Yes.
Okay.
So I have sensitive combination acne-prone skin, all of the things that don't really pair with retinol. And so something that I've learned over the years is to either use a hydrating serum or a moisturizer first. And then I'm going to apply, in my case, my prescription strength retinol, my tretinoin. And then I'm going to follow that up with the SkinCeuticals moisturizer. And that is basically your retinol sandwich. It's perfect. It's perfect for sensitive skin. It's going to help relieve that redness and flaking that could happen. But for me, it never does.
That's awesome. Triple Lipid Restore really is that one corrective cream that does so many things. And, it is good for normal to dry skin, really helps to support the skin barrier. It has a perfect ratio of lipids to help replenish the lipid loss that happens as we age, right? Like, you want to support the skin barrier and minimize the appearance of pores, but also comfort the skin. So it really is like that lifting, like firming hug for the skin that you can apply, right, like day or night. And it's lightweight enough that you can apply it during the day, which I love. You know?
Absolutely. So I feel very comfortable recommending it to acne-prone patients.
That's, especially when you're using other actives and the skin needs nourishment and support. It also helps to increase firmness of the skin and suppleness all at the same time. And again, helping with smoothing the texture of the skin too. So when we talk about, you were speaking about a hydrating serum, Sarah, just a little bit ago. I want to talk about HA Intensifier for a moment and show some love for HA Intensifier. It's one of my absolute favorite hydrating serums. It has hyaluronic acid in it, 3 different types. It's a lifting and firming, plumping hydration. Dr. Geria, is hyaluronic acid something that you think everybody should be incorporating in their skincare routine?
Yeah, absolutely, especially if you have dry skin. But specifically with this product, what's interesting about it is that it's been shown to actually increase your skin's own production of hyaluronic acid, which is why we like to pair this with injectable treatments like dermal fillers. It actually has data to support that it helps with nasolabial folds, with marionette lines, with crow's feet, and I think that's very unique.
It is. It is a full face serum. You can apply it to the neck and the décolleté and the toes if you want to. Another tip I'm taking home from Sarah. And yeah, it's just going to really help to increase your own hyaluronic acid content while providing immediate and long-lasting hydration. But it's still very lightweight. I also love, you've probably heard me say this a million times before, but you can apply it directly to the lips and actually right under the eye area for that like plump, little plumping hydration there too. Speaking of injectables, Dr. Geria, are injectables something that, like, do you see a lot of patients coming in confused about injectables and where they should start and when they should start?
Right. Yeah, absolutely. So first of all, we see people confused about what the difference between Botox and fillers are. There's a lot of people don't know what the difference is. So just to be clear, Botox is something that is injected into the muscles to relax the muscles and thereby helping fine lines and wrinkles. Whereas filler is a gel that is injected into the skin to help revolumize it. Okay, so a common issue we hear is when to start Botox. So we typically say when you start seeing the lines visible at rest is usually a good rule of thumb. With respect to fillers, we say, when you start to feel self-conscious about how you look, if it's affecting your self-esteem, then that would be a good time. I always like to tell my patients to bring a picture of what you looked like when you're in your 20s. Let's compare your picture now to what it was then. Are we happy with the progress here, or do we want to make some changes?
That's great advice. And I think, with everybody's perspective is different, right? And everybody kind of ages at a different rate. At home, you can definitely maintain and prevent and correct with a targeted skincare routine for your skin type and your concerns. That includes a vitamin C antioxidant, that includes topical hyaluronic acid, that includes, treatments like retinol and corrective creams to really maintain that skin. But there really is something to be said about going into an office, consulting with a professional, having them assess your skin, discussing, what you are looking for really, and then having an integrated skincare journey, right? Where you are partnering these two powerhouse, parts of at home and in office, and really marrying those together to get you to your skin goals faster and really provide those comprehensive and long-lasting results. So speaking of integrated skincare and in office and all of that, Sarah, do you see amongst readers that, I want to say, are people going into the office more and more? Are they looking to seek advice from dermatologists and medical professionals and authorities in the industry?
Yes, of course. But something that we're also seeing is that they see something on TikTok and that's facts. That's the truth. So a lot of what we do is, we're like, please don't do that. Call your dermatologist, go talk to them. They know more than I do. But trust the experts. The girl you saw on TikTok with the cool hair is not your derm.
That is amazing advice. I feel like we hear that all the time too, right? You see a trend, a skincare trend or a hair or a beauty trend in general. And that's, like you said, it's taken as fact a lot of times. So I'm sure that, among your readers, you're seeing a lot of that with social media and all of that nowadays as well. So I do want to talk about one more product before we dive into some questions from the audience. We have an evening antioxidant. It's in the Evening Radiance set, and it is called Resveratrol BE. So this is like if you want to take your skincare routine, your anti-aging routine to the next level and really cover all of your bases. Resveratrol BE is one of those firming and radiance and density improving nighttime serums. It's a nighttime antioxidant, actually. So for someone that already has like an established routine and they have their chosen SkinCeuticals antioxidant of choice, but they're looking to take it to the next level, Resveratrol BE is that product. I love applying it in the evening. You can apply it before or after your retinol or active of choice, and it helps to improve that density, improve that radiance, and strengthen and support the skin's natural antioxidant systems of the skin. So love that you get this in your Evening Radiance set to really enhance and increase that radiance. So I think we have some questions from the audience that I want to take. I know that the chat has probably been on fire. Don't forget, everybody, we have licensed estheticians that are moderating the chat. So if you have questions about individual products or how to layer them or routines, go ahead and ask them, and they are there to answer any and all of your questions for the next 15 minutes or so.
Yes, and Cori, I have to tell you, the chat is so active, and also everyone is loving all the tips and all the learnings and everything that's being said. It's a really fun chat to keep up with right now. We do have some questions that are popping up. The first one that is popping up is, when can I expect to start seeing results?
So with skincare, I think in general, and I'm just going to quickly give my 2 cents and then I want to pass it off to you, Dr. Geria. I say give it at least 1 month. That's my general rule of thumb, but this definitely is going to depend on a couple different factors. What do you think?
Yeah, I agree. Minimum 1 month. Sometimes, especially in the case of retinol, you could actually take up to 3 to 6 months to see the full effect of it.
And that's, definitely it's going to depend on the product and making sure you're consistent and you're using it as directed. All of those factors are going to come into play. So definitely make sure that you are using the product as directed and giving it time and being consistent with it and being patient for you to see those results. But a general rule of thumb, give something at least 1 month to see if it's working for you or not. And that's a good rule of thumb. So I just want to really quickly ask you, Sarah, at Allure, you and your team actually test products all the time.
That's our job.
That's your job.
Yeah.
I mean, really fun job. I wish I could do that. I mean, I do it all the time with skincare, but body care, hair care, like everything. So is there, in your minds, a general rule of thumb or time frame that you like to give a product or that you recommend readers give a product?
Yeah, so in the very first experience, I hope that you're like patch testing your product. We've seen so many, side effects that could happen with skincare that they just don't recognize or they haven't used before. So, go ahead and test that. And, usually we test a new product every day, which is great, but also unfortunate because we don't get that 30-day, 90-day experience to really see the results. But, we obviously try it more than one day, but there are just so many to test and so many body parts that we don't have access to that we can test on, maybe the toes. But yeah, we're constantly testing. There's an influx of products and it's a lot.
Yeah, a lot of good stuff for sure. Okay.
Yes, I'm taking from this that I can test products on my toes, and also a little bit of patience, I think, is what we're communicating about when you're introducing a new product, which I think is great advice.
Yep.
Next question that we have is, can combination skin use Triple Lipid Restore 242? So someone with combination skin looking for a little bit of advice.
I think we have some experience up here on the stage, actually. Sarah.
Yes, I have combination skin, I have acne-prone skin, and sometimes I have sensitive skin. But I always use this moisturizer. And I have zero problems because it's great. It's with ceramides. It cuddles my skin, hydrates. It's super rich but without being too rich. I can use it day and night. Yes, it's great for combination skin.
And Dr. Geria, you even mentioned earlier you like to recommend this to all of your patients regardless of skin type, right?
Yeah, absolutely. Sensitive skin, combination skin, oily skin. Like Sarah had said, it's not a heavy product. It feels it's very high. It's hydrating, but it feels lightweight and it doesn't clog up pores. Another patient population I like to recommend this for is after chemical peels. Actually, before and after chemical peels.
That's awesome. I'll locking that in too.
Same. Next question is about antioxidants. So why are we using a nighttime antioxidant when the sun is down?
Yeah, that's a great question. Well, just because the sun is down doesn't mean that the damage is done, right? The damage just doesn't turn off just because the sun's gone away. And there's also so many other factors, right? Dr. Geria, I think we were speaking about this earlier, like not just the sun that causes free radical damage.
Absolutely. Well, we know that the primary function of sleep is to repair the body's daily damage. Okay, so one of the things that the resveratrol is doing is it is supporting your body's repair mechanisms. And we are also still getting exposed to free radicals even when we're at home.
Exactly. And the upside to it, I like to say the happy side effects is that you really increase overall firmness, overall radiance, and the density of the skin with this beautiful formulation of resveratrol for the skin while you sleep. Yeah. Awesome.
Amazing. Time for 2 more questions. The next one is, I have the hydrating B5 mask. Can I layer that with this phytocorrective?
Yes, and I love that we're getting this question because we didn't get to talk about this too much, but phytocorrective mask is part of our Phyto family of products. It has this beautiful green color, but it's also a very calming and soothing and heat-reducing mask. I love to use this with hydrating B5 mask. You can use one and then rinse it off and then one right after for kind of like that double dose of hydration to the skin. You can alternate nights with it or alternate days with it, or you could just apply maybe phytocorrective mask on areas that the skin's a little bit sensitized and red, and then hydrating B5 mask everywhere else. So definitely you can use it in a couple of different ways. And I think you use it in your practice, right?
Yeah, absolutely. So I love this product after lasers. Specifically fractional ablative or non-ablative lasers. It will really help calm that skin. It helps decrease any kind of redness and burning sensation.
Fabulous. So it's such a great product to have if you are, going to start receiving those in-office treatments and you want to make sure you're really calming and soothing the skin afterwards.
I'm going to probably use it later today. That sounds very nice for my skin today. Our last question is, everyone's very excited about this Best of Beauty Allure event. So they're wondering, how can they keep up to date on future Allure events?
Yes, so like I said, we're going to do this every year in October, and so all you need to do is stay up to date at Allure's social handles on Facebook, Instagram, and Twitter, as well as allure.com, where we'll give you all of the details.
That's great. I definitely will be keeping an eye out because it was so much fun. I cannot wait to do it again. It was just such a blast. You guys had panels and experts and so many brands and just so many eager readers of yours, and the audience, they're just like so ready to learn about product and skincare. And it was just so inspiring to see really like everyone wanting to learn. We had a line at SkinCeuticals with consumers that just wanted to learn about what's good for them and give us, their concerns and their skin type. So it was really refreshing to see, like, I want to learn and I want to know how to take care of my skin and myself. That was awesome. I have a couple of questions, and I know both of you come from very different backgrounds. You're a beauty editor and you are a dermatologist, but you both are seeing trends in the industry and you help people with their skin every single day with what you do. I'll start with you, Sarah. Speaking especially with the Best of Beauty Awards, how do you vet products and how does that process happen? Like, how do you decide who's going to be a winner and who's going to win the award?
So first, I think, does this product work for everyone? We have over 100 testers every year with different skin tones, skin types, hair types, etc. And if it doesn't work for most of us or all of us, I mean, obviously there are some products that I'm going to use, but you can't use based on our skin types. But as long as it's universally showing results, it's a winner in our book.
Amazing. And for you, Dr. Geria, when you are looking at products to recommend to your patients and what to use in your office, are there certain things or a criteria list that you look for in a skincare formulation or brand?
Well, so we want to make sure that the products have been tested to be non-comedogenic, meaning that it doesn't cause acne, it won't clog pores. We want to make sure that they are non-irritating to the skin. We generally like products that are fragrance-free, and we like products that are using ingredients that have evidence to support the claims. In specific, well, the ingredients themselves, but if the brand itself has the studies to back up the claims, okay? Because to bring a product to market, most skincare brands do not have those studies. You have to, most skincare brands will certainly have the hypoallergenicity and the non-comedogenic studies, but specifically studies showing that people's lines will get better, wrinkles, firmness, discoloration. There's only really very few select brands that'll actually put the effort, the time, and the money into doing that.
And that's, who we are at SkinCeuticals. We are the #1 medical skincare brand. Very proud to be a partner in office with you and to be used and recommended by you, and you as well, Sarah. So thank you so much again for being here. And to recap both of our sets for everybody watching, you are going to be able to take advantage of these sets for a little bit longer. Again, if you have any questions, make sure you ask our moderators in the chat. We have our Morning Glow set where you're going to be receiving a 15 ml of our best-selling CE Ferulic. This is your daytime vitamin C serum for the antioxidant protection, maintain that healthy, radiant skin. HA intensifier for that plumping and firming, lifting hydration. Again, you can apply it to the lips and the eyes. You have antioxidant lip repair to help replenish lip tissue and protect aging skin around the lips specifically. And then all of our favorites are sheer physical sunscreen. Remember, 2 fingers worth to the full face, and don't forget the neck. In addition to that, it comes with the Phyto Corrective Mask to really calm and hydrate the skin. Really great going into the winter time. I know it's get kind of cold already here in New York City, and it's just gonna get colder. So wherever you are, really help to maintain your hydration levels and really support the skin throughout the season. In our evening radiance set, you're going to choose your retinol. Remember, retinol is a beloved ingredient of all of us up here. You can kind of pick which one you want to start with. If you're new to SkinCeuticals, we recommend 0.3%, and then you can build up to 0.5, and then finally 1.0. You also have your resveratrol BE for your nighttime antioxidant defenses, helping with firming and radiance and density of the skin, and then your triple lipid restore 242. Fan favorite, I think, up here. We all use it. We all love it. I feel like we all have slightly different skin types and concerns, but it's such a beautiful formula to replenish cellular lipids, really help to smooth skin texture, minimize pores, and again, pairs so perfectly with retinol. You're going to be receiving your deluxe mini samples of HAI and triple lipid restore 242, perfect for travel. Your $100 gift card, redeemable at a SkinCeuticals flagship or skin lab near you, so you can go into the office and book a treatment, really get your skin glowing, and know that you have your products at home to maintain that and optimize those results as time goes on. And if you purchase both sets tonight, you do get a little treat. So Phyto Corrective Essence Mist. So I think it's about time to give ourselves a little mist here. I love to spray this throughout the day. Have you used it? Have you guys used it? Okay, I'm going to go ahead and just immediately refresh. Just immediately. I'm going to pass this over to you, Sarah. I think we're going to end
waiting
with
for this.
Yes.
So have I. I'm like, is it time yet? Yeah. Reduces visible redness. You have humectants like
let's do it.
Glycerin and hyaluronic acid. Doesn't look greasy on the skin. It gives you that plumping hydration. You can use it throughout the day as needed over makeup, like we just did, and as needed to just give you that boost of hydration to the skin, right? Amazing. So I have one more question for each of you before we sign off. I can't believe it's already over. I don't want to leave you guys. I might just lock the doors and we can hang out here forever. But I have one more question. Is there a piece of advice that you could give your younger self when it comes to skincare routine, or just, starting your skincare journey? Sarah, I'm going to start with you.
Yeah, wear sunscreen, please. You grew up in Florida. What are you doing? Why didn't you wear it? And that's what I tell all of my friends and family as well.
Love that.
Yeah. So I agree with that 100%. Sunscreen, in addition to that, I would say wear your antioxidant as well, too. Like I said before, I like to consider the vitamin C serum antioxidant to be the backup to the sunscreen to help address that free radical damage. So it is just like sunscreen is prevention, the antioxidant is also prevention, too.
I would tell myself, you don't have to try every new product that comes out, every new brand. Stick to what is working for the skin and have patience and don't get overwhelmed. Right?
Good advice.
Yeah, great. I think all of us, our younger selves would really appreciate that.
And don't wait too long to see a dermatologist.
Yep.
Yes.
Yep. Don't wait too long. Don't forget, you can locate a physician partner near you. After the show, go to SkinCeuticals.com, use our physician locator, input your zip code, and then you'll see a list of offices pop up. We make it really easy for you to connect with them and book an appointment. And again, we'll drop your office info as well as both of your Instagram handles in the chat so that everybody can kind of connect and follow along with you and follow along on your journeys.
Yeah, great.
Thank you.
Well, this was so much fun. Thank you, everybody. We're going to sign off now. Very sad, but you can still take advantage of the offers for the next few minutes, and we'll see you next time.